Okay, section 9.3, disorders of the brain and cranial nerves. Disorders of the brain. Dementia is not a normal part of aging and is not a specific disease. It is a term used for a collection of symptoms that can be caused by a number of disorders affecting the brain. Alzheimer's disease is the most common form of dementia. It affects 10% of the population over 65% and 50% of the population over 85. Okay, neurons in the areas of the brain associated with memory and cognition are replaced by abnormal clumps and tangles of a protein. Let's see. Too far. So, vascular dementia is the second most common form of dementia. It can come on gradually when arteries supplying the brain become arteriosclerotic, narrowed or blocked, depriving the brain of oxygen, or can occur suddenly after a stroke. Confusion is used to describe people who cannot process information normally. For example, they cannot answer questions appropriately, understand where they are, or remember important facts. Confusion is often part of dementia or delirium. Delirium is the sudden onset of disorientation, an inability to think clearly or pay attention. There is a change in the level of consciousness, varying from increased wakefulness to drowsiness. It is a mental state, not a disease. It can be part of dementia or a stroke. Other conditions causing dementia are often treatable. They include reactions to medications, example sedatives, antiarthritics, remove or lower the dose of medication. Metabolic abnormalities, example hypoglycemia, correct the metabolic abnormality. Nutritional deficiencies, example vitamins B1 and B6, remedy the nutritional deficiency. Emotional problems, example depression in the elderly, use behavioral therapy or antidepressives. And infections, example AIDS, encephalitis, treat the underlying infection. So Alzheimer's disease, named after Alois Alzheimer, a German neurologist born 1864, died 1915. A common form of dementia. Brain tissue has protein clumps and tangles. Cognition, Latin for knowledge. Cognate is thinking. Iv is nature of or quality of pertaining to. So process of acquiring knowledge through thinking, learning, and memory. And cognitive is adjective meaning pertaining to mental activities of thinking and learning. Confusion, confuse meaning bewildered. Eon is an action condition, mental state in which environmental stimuli are not processed appropriately. Conscious, Latin for to be aware, conscious meaning aware. Having present knowledge of oneself and one's surroundings. Consciousness is a quality and state, the state of being aware and responsive to the environment. Unconscious, un meaning not conscious, lacking awareness. Delirium, deliri meaning confusion, disorientation, and is a structure. Acute altered state of consciousness with agitation and disorientation condition is reversible. And dementia. Ment meaning mind, D without, ia is a condition. Chronic, progressive, irreversible loss of mind's cognitive and intellectual functions. Cerebrovascular accidents, CVAs or strokes. A stroke, also known as a cerebrovascular accident, or CVA, occurs when the blood supply to part of the brain is suddenly interrupted, and thus brain cells are deprived of oxygen. Some cells die, others are left badly damaged. With timely treatment, the damaged cells can be saved. There are two types of stroke: ischemic strokes so